Bismillah walhamdulillah, salatu wassalamu ala rasulillah. Allahumma anfa'na bima 'allamtana wa 'allimna ma yanfa'una warzuqna ilman tanfa'una biha. Bismillahir Rahmanir Rahim. Rabbi zidni ilma, Rabbi shrah li sadri wa yassir li amri wahlul 'uqdatan min lisani yafqahu qawli. I'm so grateful to Brother Sultan and our masjid to let me give some talk or some discussion about the stroke. Stroke is one of the major killer as mentioned, but it's one of the highest causing the disability. We'll go through those details, but for us to be aware of it, and hopefully we can try to simplify it so that you can able to understand that, and you'll be able to hopefully prevent yourself and prevent your family or the ones that you know from the stroke, inshallah. So you can see, does it? So they have to, oh yes, okay, now, alhamdulillah. So the stroke is known as the stroke, but primarily the more of a diagnosis is called as CVA, cerebrovascular accident. So when we say cerebrovascular accident, primarily it means that something has happened to the blood vessels of the brain. That's as simple as that, as long as you keep that. Something has happened to the blood vessels of the brain. Now, generally, when we say that something has happened to the blood vessel of the brain or CVA, it is a diagnosis it's a clinical diagnosis, but basically what it means is something has happened abruptly. It is sudden, abrupt. Okay, when we say sudden, it means it is acute, it is rapid, it is sudden, it is abrupt. Sometimes it could have a step ladder pattern, that it affect one vessel, then partly another vessel, then partly. So it still could happen, but every time when something was going to happen, it should be an abrupt onset. That's the first major understanding that I. Now, the brain is huge. Brain had so many faculties, there are so many things with the brain. So whenever we think of something has happened suddenly, what could that be possibility? So it could be somebody could have a loss of consciousness. Somebody could get confused, drowsy. Somebody would have trouble with their vision. They could lose vision, they could have a variable vision, anything could happen. Somebody could have the trouble with swallowing, or they could not walk, their balance would be off, or they would become dizzy, vertigo, and they're falling, and then the room is spinning, any of those. And then the most commonly, what people could recognize more easily, I put it separately, is that if the face become asymmetric, or they have lost strength in one of their extremities, or they have lost sensations in one of the extremities. So all these are such a huge variable presentations, just to keep that in mind. But if they're happening in an abrupt fashion, the stroke or cerebrovascular disease is one of the possibility. Okay? So when we talk about the stroke or a cerebrovascular disease, that there is something has happened, two things can happen. One is the most commonly the ischemic strokes, which is 85%, and hemorrhagic strokes, which are 15%. When we say ischemic stroke, that means that somehow, whatever is the reason, that the blood vessels have been blocked and the blood flow to the brain is discontinued. Whatever is the reason, either from outside pressure, or more commonly, there is a clot into it which has blocked the blood vessel and causes the lack of blood flow to the nervous system or the neuronal cells and cause an effect. And the second thing is something has happened to the blood vessel, it has ruptured. There's a rupture of the blood vessel that can cause a hemorrhage in the brain. So when we say most commonly, because the strokes are the ischemic, we put them into a kind of whether that's we're going to look at the pictures of the blood vessels of the brain, but most commonly these are either it could be a large vessel, or it could be a small tiny stroke, or it could be a reversible stroke. It happened, it clotted, and then somehow it opened up, and then there was no neurological any kind of a deficit. So, but large vessel, easy. Lacunar, although it's going to be small, but once we'll be looking at the brain pictures, there are certain locations in the brain, even a small stroke could make a big effect. So we will look at that. So there's a lot is given on this slide. The only thing that is important is whenever somebody has a stroke, time matters. The time matters. Everything else is limited. It has given that sometimes the seconds and minutes, the event is happening within seconds and minutes, but the most important thing for all of us to recognize is time matters. Do not wait. Try to get the help as soon as possible. So that's what it is. It has given in within few seconds. It is like if there is a kind of a weakness of 5 to 15 minutes, that's a reversible, and so all of those, but time matters. Okay. Now, when we say the time matters, and there's as we were talking about the stroke, ischemic stroke, which is causing a blockage of the blood vessel, there are different ways. Number one could be if there's a disease of the blood vessel. Now this is what we are seeing in the major of the blood vessel. There have been a trouble and the disease of the blood vessel, which is with the age, everybody or more, we all develop that, but it is variable. Somebody would develop much more than that, and it can cause the blood. So as we are looking at it, so you could see that there's the blood vessel has this plaque, and then certainly in between, whenever there is a thrombus that can be broken out of it, and it can go, and then it can cause a blockage. So abnormal vessel atherosclerosis is it causes a particular kind of a thrombus. Okay. Now, so the next one is sometimes a clot could be thrown far away. Most commonly, the heart is the place which can throw a clot, which can go all the way to major blood vessels and then would go and block one of the vessels. But generally, when the aspect to understand is that when brain is throwing those clots, they are going everywhere. But because we can do the imaging, we can look at the pictures of the brain, then we could see those, but we may not be able to see if they've been thrown to the stomach, if they've been thrown to the liver, if they've been thrown to the spleen or the kidneys, you could not see them. But the one which have been thrown to the brain, you can see them. So when you're looking at the picture, it's going to show that if there's abnormal vessel, it can throw a clot. The major vessels are the carotids or the neck vessels, or the clot could be thrown from a distance, most commonly the heart. So this is what the picture is showing, that the two different kinds of the clots. One is because of the disease of the blood vessel itself, and the other one is if there's a distant clot was thrown from the heart or from other vessel, and that would be seen. Okay. So generally, when we say it's the occlusion of primarily the blood flow, and when there's a fall in the blood flow, it's just a matter of minutes that it can cause and damage the neuronal cells. So we have to be kind of proactive to understand that, and proactive to be able to work onto it. It has given certain values. They're more of that how much would be the reduction of the blood flow that can cause the significant neurological event or a symptom. Just wanted you to have a general idea. The brain is so complicated, and it has a very complicated blood supply. So generally, this is the whole kind of a picture, which is the one below is the posterior circulation, and the above is the anterior circulation. So primarily, the posterior circulation, it makes the two blood vessels known as posterior cerebral arteries, whereas the anterior circulation, it makes the middle and the anterior cerebral arteries, and then they are connected together and it makes a circle. It is known as circle of Willis. So that's how that basically is, but it's a kind of a complicated blood flow. Now, so when we talked about the ischemic strokes, one of the event in the ischemic stroke is a TIA. TIA means there's the transient lack of blood flow to the brain, which cause a particular event. The particular event could be speech, vision, kind of a weakness in the arm, leg, or any transient confusion. Anything else could happen, but because it's transient, generally lasting for few minutes, and then it resolves, so we call it a transient ischemic attack. Now, when we're looking at the brain, just to have a general understanding that the left side of the brain controls the right side of the body, and right side of the brain controls the left side of the body. So it crosses. And then the left side of the brain is more objective. When you're looking what are the things that it controls, both of them controls the motor aspect, the sensory aspect, but there are particular things that the left side controls, there are particular things that the right side controls. The left side controls more of the speech. It also controls the mind, like the calculating mind, the mathematics, the numbers, and all that. It controls your handwriting. And then also the reasoning, the scientific function, all those objective functions are controlled by the left side of the brain. Whereas the right side of the brain is more of an artistic brain, where it is the music, the orientation into the space, the art, the awareness of the art, creativity, the insight, and all of the thinking, the other artistic thinking, it has been primarily part of the right side of the brain. So I've just given you the different, as a picture of the brain. It is divided into 4 lobes. The front one, the yellow one, is the frontal lobe. The purplish one is the parietal lobe. The green one is the temporal lobe, and the blue one is the occipital lobe. All of these different lobes have the different functions. I've just identified that the motor speech area is part of the frontal lobe, and you could see it is known as Broca's area. But the speech has the 2 aspects. The interesting thing about the speech is that one aspect is to speak. The second aspect is to understand. So if somebody is talking to me, I could not understand, that is the posterior part of the brain is known to control the receptive speech, how to understand the speech. Whereas the front part, the frontal area, it controls how to speak it. So sometimes when somebody could have a stroke, it can affect only one of the part, and it kind of, that's the reason sometimes the stroke or neurological disease is very tricky. I just want you to, keeping this picture, I want you to tell you a little story that I saw a patient who was in prison, and then he was brought to the hospital, and he had a stroke. But weirdly, the patient had a stroke of the parietal lobe, which is the sensory part where you lose your consciousness, or not lose the consciousness, but you become confused. He was confused, and his sensory part of the speech, the speech that understands, if somebody asks me or give me a command, lift your left hand, if I don't understand that, I would not follow that. But because my motor part is fine, somebody is telling me to do something, he tells me, tell me your name, and I started doing something else. I give him some another answer. So what happened to him was, he had a part of the stroke in the parietal lobe area, which affected his receptive or sensory speech. So he was driving, he had a stroke when he was driving. So he was driving recklessly. So he was stopped by the traffic police, and the patient was able to walk. His motor strength was fine because it didn't affect his motor area. So they thought he was drunk. They asked him a question, and he answered something else. They said, where is your license? He was telling something else. They were asked, so thought he is drunk. He was taken to the prison, and subsequently found that he had a stroke, and the stroke was such that he was acting weirdly, and he could not understand that. So the human mind is so kind of that you never know it. But it was not the fault on the part of traffic police, but they couldn't understand. Somebody was driving recklessly, they thought drunk, later on found out that he had a stroke. So, and the different areas, in the same way, temporal area is more with the emotions as well. The posterior part of the brain is more with the vision. It affects the vision. So different areas have the different functions, and sometimes that's how you have to recognize what part or what area is affected. So I've just given these different names. Then the reddish area, which is right at the base, is where you could have the motor strength, the speech, everything is there, but you lose the fineness of the movement. The patient they would have the strength, but they would not have the fineness. They would lose their balance. They would lose their balance in their speech. When they will be talking, you could not understand that because they've lost their balance. So there is a separate area that controls the fineness of the movements, okay? So again, I'm just showing that for you to have an understanding. The frontal part of the brain is more for the motors. The posterior part is more for the sensory aspect. And then there's a speech area that is for speaking. There's a speech area for understanding. There's the hearing area, then emotions, and then the vision, okay? Yeah. So now, when we mentioned about the stroke is very kind of one of the common causes of the death. Initially, it was considered to be the third most, but now it's not the primary cause of the death, but is one of the leading cause of the disability. I'm just going to go through some numbers for you just to have. So 1 in 6 deaths from the cardiovascular disease was thought to be because of the stroke. And then it has mentioned every 40 seconds, someone in the States has a stroke. And every 3 minutes and 40 seconds, someone dies of the stroke. Then the numbers are more than almost 800,000 people in the States have a stroke, and of those, 600,000 had a stroke for the first time. So it's so common that. Then, of about 200,000 strokes that we see, that is 1 in 4, happens. It can happen. It's not that somebody has a stroke, would not have a stroke again. It can happen. There is such a high recurrence of 1 in 4 could have a new stroke. Then, as we mentioned, that 87% or 85%, above 80% have an ischemic stroke. That means their blood vessel is blocked and the blood flow to the brain was not sustained. Now, so also, when we mentioned it's a leading cause of disability, it's one of the very highly cost related for the management and for these people. If you look at the numbers, they say about 56.5 billion was spent between 2018 and 2019 because of the stroke. Whether somebody has a disability, whether somebody could not go for the work, and the management, and all of that, it's such a high cost. And then, so such a high disability in the stroke. So when we are talking about the stroke and CVA, just want to make sure that we understand it, and hopefully if we can prevent it. And the other thing for us to know is this map, this shows that Tennessee, Memphis is one of the stroke belt, very high incidence of stroke, only just by these pictures that shows. Okay, now, so we have already have a basic understanding of the functions of the brain, the blood vessels, and the blood flow, and the ischemic stroke. And now, here is that somebody has presented and had an acute stroke. What to do? Number one, let's go on to it. So, the term that is being commonly used is FAST. FAST stands for F for any facial asymmetry, A for arm, losing strength in the arm, S for speech, they've lost their speech, and then the time matters. As I talk to you, then the time matters. So, recognition of any facial asymmetry, any motor weakness, any trouble with the speech, do not wait. Do not wait. Call the EMS. So, when something like that, we know that so the primary goal at that point in time is call the EMS, call 911, and make sure that it is not a stroke. If there is any little doubt, it is always better to take the patient to the hospital. Generally, there are very limited facilities which have the complete management plan for the stroke. So it depends upon the stroke, but our goal is the moment we recognize any of those facial, motor, speech effect, call the 911 and go. Now, we will talk about whenever the patient now, we say that we have called the 911 and the patient has arrived in the hospital. Now, if I'm going to see the patient, there are three main targets. The first one is, I would like to evaluate if the patient really needs the acute therapy, we'll go through the acute therapy. Number two would be, once we recognize the patient has a stroke, how to prevent the recurrent stroke, and then what should we do to prevent the complications coming from the stroke, okay? So let's go to that. So now, I'm just showing you this is the normal picture of the blood vessel where we have a good blood flow. Next, we see, as we talked about, either it's going to be a thrombus coming from the blood vessel or there's a clot coming from the heart. It has blocked the blood vessel, so the blood is not flowing through this vessel. So our ultimate goal at this point in time is how to break, dissolve this clot so that we can restart the blood flow in the blocked vessel, okay? So let's see, what do we have to do that, okay? So now, the moment the patient arrives in the hospital, in the ER, and seen by the ER physician, we have a complete, it's a medical response team. It's a complete set of physicians, the nurses, and everybody is aware of that. And the moment the patient arrives, the time starts counting. How quickly can we take care of all of the stuff to take care of the patient? So that's important. So the moment they arrive, the first is the clinical evaluation, making sure if the patient really had a stroke. So it depends upon, there's a criteria which is known as NIH score. It's basically, NIH score is the score that gives an indication how bad is the stroke is, and then depending upon that, what would be the management plan. So basically, the NIH score looks at somebody's, how much they are aware, would they know what month is this, the time, place, what their speech is like, what their face is like, what their motor strength is like, what their sensory feelings are like, and also what is their balance and all those. They take care of all of those neurological functions and they score it. If the score is too high, that means that the big vessel is affected. If the score is low, then that means one of the smaller vessels is affected. So the moment the ER physician or the neurologist in the ER evaluate the patient, the first and the most more important thing is that they would do two things. Number one, they would do the CT scan of the head, and they would do the CT angiogram. CT angiogram is to look at the blood vessels of the neck and the blood vessels to the brain. So they're going to do it. It would be stat there and then, okay? Now, so once they do the CT scan of the head, now, when we assess the patient with the stroke, besides the NIH score that we see, it is also important to know the time of the stroke, because it depends upon, if the stroke has happened 24 hours earlier, there's no, the time matters. So because when we are going to look at the imaging, it is going to give an idea whether we need to do any active management or not. So I'm showing you the two pictures. One is the brain with the white that you see. It's on your, all that white area, it's a hemorrhage. Whenever you see a CT scan and you see a white spot like that, that's a brain hemorrhage. So that when somebody has a stroke, but it's a brain hemorrhage, then you're not going to do that clot busted medication, because that medication is basically to break the clot, is already going to increase the risk of a brain hemorrhage. So when somebody has a stroke, because they have the brain hemorrhage, there's a different management plan. The other picture shows that on half of the brain is kind of a gray, and the other half is black. The black part means that the patient had a stroke in the major vessel. We call it as middle cerebral artery. The patient had a stroke, but it's been there for more than almost 24 hours. So the patient had a stroke with already there's a blood vessel which has been blocked, and it is showing its signs of the CT scan. Again, that means the time has already passed by. So when the physician is looking for is, they're looking for almost a normal, healthy brain. No bleed and no obvious stroke is visible. They are looking at that. The only thing that they have is that the patient has signs of the stroke, but the CT scan does not show a stroke. Now, because CT scan takes about 6 to 8 hours to show the stroke. Now, what they do is the second test that I mentioned, the CT angiogram, they do the CT angiogram to look at the blood vessels of the brain. And the blood vessels would show if there's a clot and that is blocking one of the vessels. Or they would not show the clot if they're so small, but then they would still know that the stroke has happened, but it's not big. So depending upon the size of the clot, the management would go. So if it's a small size, I'm just putting it, I think that primarily whenever this is it, first thing we want to make sure it's an ischemic stroke, it's not a hemorrhage. And then the time matters. If the patient has come to see us within 4.5 hours, then there's a particular medication, we call it TPA. It's, in the simple term, it's a clot-busted medication. It basically blocks, it basically dissolves the clot and then opens the blood vessel. So primarily, that's the first thing to do, that the patient arrives, it's less than 4.5 hours, and then we know the patient had a stroke clinically. His CT scan, the patient's CT scan did not show anything, and then we go ahead and give that medication. So there's a complete protocol to that, and we hope that if it's a small clot, it would be dissolved by the medication. So that's the first thing to do. Now, if the clot is large, if there's a big, large clot, our clinical impression would already show it. As I mentioned initially, that there is an NIH score. That NIH score would indicate how big the clot is. And that at that time, the clot busted injection that we have given initially may not be good enough. So when the patient arrives, we have done the CT scan, we have done the CT angiogram, we looked that there's a big clot sitting over there. So we have already alerted either the vascular surgeon or the interventional radiologist or one of the interventional neurologists, so that they should be ready to move on. They go in, they basically are going into the blood vessel. They're going to go all the way, as this picture shows. They would go and they would retract that clot. So if it's big enough, the injection, the medication may not be good enough. So this is known as thrombectomy. Mechanical thrombectomy means that you're going to withdraw that clot to retrieve the blood flow. So it is all of that. It is a very timely management plan, and it is that the moment the court stroke is called in, all of the relevant specialties are aware of that, and they are there on board. So the moment CTA is done, then if it shows a big clot, our interventional vascular surgeon or the interventional neurologist is aware of that, and then is going to go and then do that. Okay? Now, I'm showing you the picture. Now, on the left side, this side, okay, we see that the blood vessel there's a blocked blood vessel that you would see that once we did the angiogram, we could not see the blood vessel. It's blocked. So when that happened, the intervention vasculars went in and retrieved that clot which was there. Once we have retrieved the clot, and now you see that on the other side, you start seeing the blood flow on that one. So it is all. Now, why does the time matters? The time really matters is because when you look at the brain is a very soft, loose, soft tissue. So if much more time has passed by and you are going to open this vessel, The only thing it's going to do is it is going to cause the reperfusion hemorrhage. It is going to be more disastrous compared to the initial stroke. It can cause a brain hemorrhage just by opening the vessel. So because once the blood flow in that area, the area has already been damaged, it's going to cause a hemorrhage. So the timing matters before it causes necrosis or death or of that area. Okay. So whenever, just some simple, that whenever we have to decide, so the most important thing is to decide about whether the patient needs that acute treatment or not. There are certain inclusion criteria, exclusion criteria, but that's more for the physician who is managing the patient, not for us. For us, the only thing is time matters. Call the EMS, call the ER, and then 911, and just go to the hospital. Okay, now. So the most important thing for us, for all of us to recognize is, why is it important to recognize that it's a stroke? Because there is acute treatment available, and if you do it, there's a good chance that a good recovery can come and patient would not be disabled. So it is important to recognize it timely because there's a treatment available. There are other ways, we'll talk about that. But there are other ways that the stroke-like symptoms can present, but they may not be stroke. We'll talk about that. Okay, so the second part is, once we have made a decision whether the patient needed acute therapy or does not need acute therapy. Sometimes when the patient has presented late, the patient may not need acute therapy. In that situation, we have to do the second management, how to prevent the recurrent strokes and how to delay and how to avoid the complications. So there are different aspects to that. You want to make sure that the blood pressure is well controlled, blood sugars are controlled. There's special kind of aspirin and Plavix, the two treatment therapies that have been done initially. You call them as dual antiplatelet therapies, and then we work on reducing your cholesterol, and then we follow the swallowing of the patient. We want to make sure they do not develop any clots in their legs, any clots in the lungs. They are well hydrated, and then we run the physical therapy and our occupational therapy and speech people to help with the patient, and then we're thinking of long-term management of those patients, okay? Now, the most important early complications could be that we want to make sure that the patient do not get another stroke, the patient do not, including they can get cardiac arrhythmias and then urine infection, aspirations, pneumonias, and then sometimes they get so depressed, anxious, anxiety. There's so many, so you have to keep a watch on all those aspects. And then how to avoid, it becomes more important that once we have done the initial management, the next step is more educating the patient, looking at the different risk factors for them to have a stroke, and then to see, could we do something to prevent the stroke in future. There are different risk factors, some are modifiable. The most important thing is, one is hypertension, high cholesterol, diabetes, but then smoking, drugs, some other things, there are other risk factors. So just to keep that, that's what the next step is for our patients. Now, the thing is, when somebody presents with the stroke-like symptoms, could it be anything else? Yeah, it could be. But that's the job of the physician at work to identify that. So it could be anything. Somebody could have sometimes the patient presents with a seizure, but actually looks like a stroke. Somebody sometimes could have a tumor and there's a bleeding, the tumor could die. Sometimes a migraine headache can present like a stroke. Sometimes a patient is confused because of his sugars went up or sugars went down, or sodium, or some other things. Sometimes they have the infection like meningitis, something else. There's another disease which is commonly called as demyelin, but in simple terms is known as multiple sclerosis, a disease that can present like that. And sometimes you could have somebody act like that having a stroke, but actually is not having a stroke. So but that's the job of the physician who is treating them to take care of that, not our job. My job is, if somebody acts like that, I want to make sure that they are in the right place and making sure that they are not having an acute stroke. Okay. Now, there's another term that has been used. Generally, when we talk about stroke, age is the common, as with the increasing age, you have the more risk of a stroke. But there's different terms, especially in the younger people, and you have to be kind of more aware of that. But that's more for the physician, but generally it's a different way. When somebody has a stroke at a younger age, you want to make sure it's not their heart, it's not their clotting mechanism, they're not having an underlying some other disease causing stroke. So it's a different concept, okay? Okay, so just to show that once we identify an abnormal vessel, it's also we can do the stenting. On one side you see that there's the blood vessel is kind of blocked, and then they put in a stent and open it up. So now, I think if that's good. There are 3 stories I wanted to share. Just where, because the brain is fascinating. Brain is limitless, and the brain is not just the brain, physical brain, it's the mind. So the first story I wanted to share was the creation of Adam. إِذْ قَالَ رَبُّكَ لِلْمَلَائِكَةِ إِنِّي جَاعِلٌ فِي الْأَرْضِ خَلِيفَةً. And then when the angel said, قَالُوا وَتَجْعَلُ فِيهَا مَنْ يُفْسِدُ فِيهَا وَيَسْفِكُ الدِّمَاءَ وَنَحْنُ نُسَبِّحُ بِحَمْدِكَ وَنُقَدِّسُ لَكَ. That how could you send somebody who's going to cause the bloodshed and then mischief, and we are doing your وَنَحْنُ نُقَدِّسُ بِحَمْدِكَ وَنَحْنُ نُسَبِّحُ بِحَمْدِكَ. We are doing your tasbih and all of that. Allah subhanahu wa ta'ala said, قَالَ إِنِّي أَعْلَمُ مَا لَا تَعْلَمُونَ. So what Allah subhanahu wa ta'ala said, what I know you do not know. And then what Allah ta'ala, وَعَلَّمَ آدَمَ الْأَسْمَاءَ كُلَّهَا. He taught Adam, عَلَّمَ آدَمَ كُلَّهَا ثُمَّ عَرَضَهُمْ. Then he asked the angels, okay, tell me the names. And they were to say, if you're قَالُوا سُبْحَانَكَ لَا عِلْمَ لَنَا إِلَّا مَا عَلَّمْتَنَا إِنَّكَ أَنْتَ الْعَلِيمُ. So, and then Allah subhanahu wa ta'ala told Adam, قَالَ يَا آدَمُ أَنْبِئْهُمْ بِأَسْمَائِهِمْ فَلَمَّا أَنْبَأَهُمْ بِأَسْمَائِهِمْ قَالَ أَلَمْ أَقُلْ لَكُمْ إِنِّي أَعْلَمُ غَيْبَ السَّمَاوَاتِ وَالْأَرْضِ وَأَعْلَمُ مَا تُبْدُونَ. So I was thinking that looking at the knowledge, so Allah subhanahu wa ta'ala gave the preference to the Adam because of the mind, because of the knowledge, because of the choices he would have the knowledge to make the right and wrong choices, and he have the power to make those choices. So Allah subhanahu wa ta'ala gave him the preference. So how much of a knowledge Adam was given, that we are getting that knowledge and creating that knowledge all the way that we could not have imagined it. And then the second story was the story of the Hazrat Solomon, when he was saying, قَالَ يَا أَيُّهَا الْمَلَائِكَةُ قَالَ أَيُّهَا الْمَلَائِكَةُ أَيُّكُمْ يَأْتِينِي بِعَرْشِهَا قَبْلَ أَنْ يَأْتُونِي مُسْلِمِينَ. So anybody can bring the throne of the Malaka Bilqis, the queen of Sheba, for me. And then the jinn said, قَالَ عِفْرِيتٌ مِّنَ الْجِنِّ أَنَا آتِيكَ بِهِ قَبْلَ أَن تَقُومَ مِن مَّقَامِكَ وَإِنِّي عَلَيْهِ لَقَوِيٌّ أَمِينٌ. And said, he was stalwart, the powerful jinn. He said, I'll bring it to you before you rise from the council. Surely I have the power. So jinn was powerful, strong, and I'm trustworthy. So the jinn was mentioning about the power that the jinn has, the physical power. But then, قال الذي عنده علم من الكتاب أنا آتيك به قبل أن يرتد إليك طرفك. But there was someone who had the knowledge or the ilm of the book. And what was he said? He didn't say, I have the power. He said that I will bring it before the blinking of your eye. So the knowledge, the power of the mind, that Allah subhanahu wa ta'ala has shown how much of the power of the mind is. And then I was thinking of the Star Trek when we were in 70s, that they would put them in a tunnel and then they would be transported to some place else without any physical means. So and then for us, then what was the lesson? The third story was, what was the first lesson that were taught to us by Allah subhanahu wa ta'ala through Prophet sallallahu alaihi wasallam? اقرأ بسم ربك الذي خلق خلق الإنسان من علق اقرأ وربك الأكرم الذي علم بالقلم علم الإنسان ما لم يعلم. So started with the knowledge, ilm, mind, and the brain. So just wanted to share with you that protect your brain, respect your brain, make sure that we live a healthy life to keep us healthy and to keep a healthy life for our friends and the one that we know. Jazakallahu khair. If you have any questions. Yeah, business. Yeah, all the major, the acute stroke is all of them there. But considering the, uh, with the acute management regarding the TPA, all of them are. But regarding thrombectomy, or you have to have those, they would be the most major one. The university at the Baptist East would be the one that have that, and it depends upon if they have the expertise that the other, because if intervention radiologists are doing it, would be, that's separate. But what happens is once they do that and they know that the patient needs to have a thrombectomy done, they are airlifted to the facility. So that's what happens. So the most important thing is reach the hospital. They are airlifted. Yeah. For the hemorrhage, now with the hemorrhage, it's not something now urgent or acute. If the hemorrhage is big, you have to go and do the surgery. Okay? But also again at that time it becomes important, because if the hemorrhage has affected the dominant part of the brain, like the left side of the brain is dominant and somebody already has such a huge hemorrhage, then sometimes the people may not like to do anything if it's a huge hemorrhage. But if it has affected the non-dominant part, and even it's a huge hemorrhage, then the surgeon can go and then, so generally what you do is you do the craniotomy to really because the brain starts swelling, it can cause a herniation, so you do that. And then otherwise, if it, depending upon the bleed, you manage the blood pressure and then go with that. And then if the patient was taking any kind of a blood thinners, you stop it. The Bell's palsy is not a stroke. Bell's palsy affects a facial nerve, but it does not affect the brain. So the brain is sending all the nerves. So the nerve could be affected on the way coming out of it, but it has not caused. But you have to do the MRI of the brain to make sure that it has not caused the Bell's palsy is not coming from the stroke. But whenever there's a facial asymmetry coming from the stroke, it appears differently as compared to the Bell's palsy. So clinically you could still see it, but still have to make sure that it does not show it on the MRI. Okay. Any other question? Okay. Jazakallah khair. Thank you for listening.